I'm Dr. Donald Hohman, board certified orthopedic surgeon, fellowship trained, and I specialize in joint replacements of the hip and the knee. Knee replacement can mean a couple of different things. So, when you start to talk about the surgical management of arthritis, very commonly people will completely wear out their joints and they'll have bone-to-bone arthritis. Now that can happen in a few different places. You can have a knee that only wears one compartment of the knee. And so a form of a knee replacement is a partial knee replacement, which is a nice operation for somebody. It's a smaller operation than a full knee replacement. It's also important for people to understand that knee replacement doesn't mean that we chop out your whole knee and plug a new knee in there. It's really just a resurfacing of the ends of the bones. So a knee replacement is kind of a misnomer. It's just a term that has kind of stuck throughout history, and everybody uses it because it's just commonplace. But a knee replacement is really a resurfacing of the arthritic ends of the bones. So in a full knee replacement, you open up the knee and you resurface all three compartments of the knee: the inside joint, the outside joint, and the kneecap joint. And that's a full knee replacement. Partial knee replacement would be where only one of those compartments would require resurfacing of that portion of the joint. So it could be the inside portion of the knee or the outside portion of the knee, or even there's an operation where you can just resurface the kneecap portion of the knee. And so when you find people that are candidates for those kind of operations, that's a nice solution because it's less surgery, it's an easier recovery, it's less blood loss, it has less complications associated with it. And people tend to like partial knee replacements because you get to keep a lot more of your parts. I always tell people you're always better off with your own parts if we can keep them. So knee replacement can mean a few different things depending on where the problem is and what portion of the joint is worn out.